live virtual event for Skin Rejuvenation, where we're going to be talking about BBL, CoolPeel, and Halo. I'm Mindy Bullock. I'm one of the laser techs here at DTRN.
And I'm Krys Gibbons, one of the other laser technicians here at DermaTouch.
Please stay till the end of our little presentation because we're going to be answering all your questions live in regards to more in-depth detail of what these can do and how they can actually complement your skin needs.
Additionally, we have 3 great prizes available to winners who stay until the end. So those prizes include a complimentary Halo treatment, a $250 gift certificate here at DermaTouch RN, or a 2-ounce HA5 Hydrocollagen Rejuvenating Hydrator. So don't forget, stay until the end.
What is BBL? BBL is broadband light, commonly known as photofacial. What it treats is your browns and your reds. So any type of sun damage, rosacea, broken capillaries, it treats all of that, and it can be treated from head to toe. So Halo. Halo is our hybrid laser. What that means is got 2 different wavelengths that fire at the same time. One is a heat component, one is ablative. So similar to the CoolPeel, but a little more intense. So it's still going to treat your hyperpigmentation, pores, texture, fine lines, deep wrinkles, and then it also has the ability to get a little bit of tightening out of it too. So the ideal candidate for this is going to be anyone that is wanting to just kind of have a fresh start. It does have more of a downtime. We typically see about a week of downtime with this, but it's a wonderful, wonderful treatment, and it can be treated with BBL as well. CoolPeel. So CoolPeel is a fractionated ablative laser. It treats hyperpigmentation, texture, fine line, and pores. What it does is it superheats the water in our skin to vaporize it. So it makes little holes all over our skin. It can have minimal to some more downtime depending on what we're trying to achieve and what our goals are. And so we talk about that in the consultation. The cool thing about CoolPeel is that you can add it on to a bunch of treatments that we offer here at DermaTouch. Diamond Glow, let's see, BBL, even your Botox treatments. So it's a wonderful treatment. It treats all different types of skin types too.
So depending on what a patient is working on with their treatment plan will depend on how quickly they'll see results. So patients who are working on tonal improvements are going to see results much quicker than those who are, say, working on wrinkles and deeper texture like acne scarring. Typically patients that are working on conditions that have to do with texture, typically it takes a little bit longer for that to kick in. So around 3 months is when you typically start seeing improvements, but you can continue to see even more improvement for really up to 6 months after the treatment.
Okay, here's another thing that everybody's always concerned with is downtime. And downtime varies based on each person and the way that we heal. The longest of the downtime we typically see can be up to a full week. With the BBL, the downtime can be at a beginner level. You get what we call as peppering. It looks like little coffee grounds. They start to flake off about day 4, day 5. Whenever you don't think they're going to come off, then usually the next day they'll come off. And you can get a little pink and a little puffy, but typically we just see a little pinkness and the micro crusting. But when we get into CoolPeel, right, what are we working on? What are we willing to deal with? It's kind of part of our consultation. We can make the CoolPeel kind of have a downtime of just a matter of a few days, all the way up to, we've had people look as bad as they do after a Halo with the CoolPeel. And that could be up to a week. And what we see there is micro crusting, redness, severe swelling can happen, and then just dryness, right? And so that's whenever we make aggressive CoolPeel, act like more like a halo. But the halos where we see more of the extremes, where you get a lot of microcrusting. You can be a pretty bright to deep red, and then you can get swollen. We've had people swell pretty crazy. Yeah. But again, it's all stuff that we can manage and that we would discuss in our consultation on what we can do as far as downtime goes. The ideal candidate, I always joke, if you've got skin, you're a candidate to do it, right? But we do have to take in some considerations. So certain lifestyles, if you're out in the sun a lot and we can't afford to not be in the sun, you would really have to plan accordingly for that. For the halo and the BBL, we do have to be careful, unfortunately, with darker skin types. But the CoolPeel, right? Like, I always joke, I'm like, everybody that comes into DTRN is getting a CoolPeel.
Absolutely.
All three of these treatments that we discussed, they can be combined, whether it be BBL CoolPeel, BBL Halo, or if you wanted to get really willy-nilly, you could do BBL Halo CoolPeel. So why would we do that, right? I mean...
Yeah, so it depends on what we're trying to achieve with a client, but especially if we're looking to improve the quality of the skin, the tone of the skin, these really combine together to make an ideal treatment that addresses overall tone, so reds, browns, plus the overall quality and condition of the skin. So whether it's fine lines, wrinkles, acne scarring, just in general pores, it really helps to rejuvenate and refresh the skin overall.
Hi, I'm Mindy. I'm one of the laser techs here at Dermatouch. Welcome. So what brings you in today? What are your skin concerns?
So main concerns are redness. I have a lot of redness, especially around the center of the face. Pores, I definitely want to target that. Texture as well is going to be something.
I have like the best combo for you. So, and I just love what it does for pores. I have one that does pores and redness. So let's talk about doing the BBL CoolPeel today. With the BBL, that's going to really address your redness. It does help with pores. Over time, we can see it with texture, but that's what the CoolPeel is going to be for. The CoolPeel is going to get those pores, get some of those deeper textures. And so we're just going to kind of, with those two treatments, it's going to encompass everything you're kind of looking for.
Ooh, I'm excited! Yes. It was pretty good. I think the most startling thing was the light from the BBL. Everything else was pretty bearable.
And you numbed before?
I did numb for a little while before, just because I wasn't sure how I would feel with both treatments together. This is my first time doing the combination.
Awesome. So on a scale of 1 to 10, what was your pain?
I think at the most either a 3 or a 4.
Awesome. Well, thank you so much.
Thank you.
We're looking forward to your results.
Thank you so much for taking time out of your evening to join us on this virtual event to learn about BBL, Halo, and CoolPeel. We're going to be around for the next 15 to 20 minutes to answer any other questions you may have.
Additionally, be sure to check your text messages because you'll be able to book a consult directly through your text, as well as the winners of the prizes will be notified via either text or email. And don't forget, those prizes are a free complimentary Halo, a $250 Dermatouch RN gift card, or a HA5 Rejuvenating Hydrate. Hi there, this is Chris and Mindy, and we are here to answer your questions. Give us just a moment. A lot of questions are coming through, so we're going to do our best to answer as many questions as possible during today's event.
And again, thank you for joining us this evening. Clearly, I can't speak. And give me a moment because I might need some readers I discovered to read these questions too. So I'm so glad that y'all are really interested and have all these wonderful questions. We're going to try to get to all of them this evening. If we don't, we'll be personally reaching out and contacting you via text or email or phone call to further discuss anything that you want, or even to book you a consult so we can assess you better in person. So something that we do run into most commonly when we're doing laser treatments is, hey, I have this hyperpigmentation. Can we treat it? Well, sometimes this hyperpigmentation is actually melasma. And with melasma, unfortunately, a lot of heat and light-based devices can trigger it and make it worse. So BBL is in HALO. We do not recommend at this clinic to treat melasma. However, CoolPeel, we have treated very conservatively, but we have treated melasma with it. We do give you all the big disclaimer. It could potentially make it get worse, but we've had really good luck in not seeing that happen. But it is a risk that can happen. But so for melasma, typically just the CoolPeel out of the lasers is the safe one to treat with.
Absolutely. So we have another question. If I have a trip coming up where I have to fly and would attend an event, how long before the trip would you recommend me to get the treatment? I personally would say 2 to 3 weeks, depending on the event. Really, you're healed in about a week's time, but giving yourself a little buffer time is always a good idea.
And then even traveling, depending on where you're traveling to. So they're lasers, we want to protect our skin from the sun. And with some of these treatments, we have pretty strict no sunlight.
Yes.
So depending on what treatment we're doing, BBL, 2 weeks of no direct sunlight, wear your big hat, reapply your sunscreen if you're going to be out and about. CoolPeel, no direct sunlight for a month. We're pretty strict about that. Yeah. And then your HALO, it's no direct sunlight for 2 months. And this is, yes, you can do your daily go to and from everywhere, but we're getting into kind of somewhat nice weather for Houston. So if you're wanting to enjoy the weather, just wait, and then we'll do your HALOs when it starts to get a little bit more colder and yucky outside. Let's see, how often? So how often should we get these? Depending on what we're doing, what we're trying to achieve, our rule of thumb is every 4 to 6 weeks it's safe to do. That is what clinical studies are done on. So we would be spacing these out 4 to 6 weeks. BBLs, we do them in series of 3 to 5 potentially. CoolPeels, the same, about 3 to 5. And HALOs, we're mostly looking at 1 to 2 for the average person, depending on what our end goals are. How much stuff that we need to kind of work on. And some of the sun damage has been there for a long time. It might take a little bit to get it off. So it just depends. And again, this is something that we will, if we are able to see you in person and we do a Visia skin analysis and take pictures, and we can come up with a personalized plan for you and your skin. And for your upcoming travels, your events and things like that, we can plan it out accordingly to what suits you.
And, as Mindy said, it's a personalized treatment plan. So that's really where we determine how many sessions you're going to need of whichever modality it is that we really decide on for your improvements that you're looking for.
And then, so improvements. Y'all, dang it, Amazon, we want it now.
So this person wants to know how soon they can expect to see improvements after receiving the treatment.
Unfortunately, we're not Amazon, not now. Well, with the BBL, you can actually see some of your results. Once your peppering goes away, you can see results in about a week. Yeah. Even, with CoolPeel's HALOs, you might look a little crazy for about a week, but once it starts to clear up, your skin does look more radiant and smoother. That when we start talking about more texture, fine lines, pores. Pores you can see pretty quickly too, wouldn't you say?
Yeah.
But texture, sorry.
Oh, that's okay. I was going to say a lot of my clients will really give feedback early on that they feel like around their eyes improve pretty well, especially with CoolPeel. So I think that that's a nice, instant kind of take back, so to speak, or very early. And then also we have this thing called the Halo Glow. So about a week after your treatment and your skin's all healed, you have this really glowy, beautiful skin. So that's an immediate payback as well. But really most of the time it's about 2 to 3 months to really start seeing improvements in the skin. And then around 6 months after your last treatment is when you would see really the maximum from the series that we do for you.
And then, makeup. Really, with the BBL, you can wear makeup right after. It's totally fine. You just got to be careful when removing the makeup. You don't want to pick off any of the little peppering that we have created. But when we are talking about CoolPeel and Halo, we're getting rid of skin. So we've created some micro injuries in that tissue. So we don't want to apply makeup, a few days for the CoolPeel, really with the Halo, at least a week of not any makeup, just to be on the safe side. We're trying to improve the skin. We don't want to do anything to get in the way of that. And
truthfully, it doesn't really set very nicely when your skin is healing from those procedures, because there is a little roughness to the skin where we have the little tiny micro scabs, which is all part of the procedure and all part of the rejuvenation process.
Okay.
So we have a question of what you can do in advance of laser treatments to minimize downtime. You want to take a stab at that one, Mindy?
I love this question. So some of the things that you can do, having a nice, healthy, hydrated dermis and skin in general really helps to facilitate the healing process. But things that we do it's a growth factor. So it's the Skin Medica TNS, post-procedure serum. We really like to prep the skin with that. And we can start that 2 weeks prior, as long with the TNS ceramides cream. So that's just going to help to really make our skin just be a little more resistant to everything. But it's really hard to say. We can plan and plan and plan, but we never know until we kind of get in there what's going to happen. But then prior to treatment too, you can take Tylenol, Pepcid ACs, shockingly enough, with
an antihistamine, it'll help with the swelling, absolutely. And then also, sometimes I've had a few patients come in and their primary concern is redness. So in that case, a lot of times it's also a skin barrier issue. So if that's the case, we actually need to work on the health of the barrier first before we get into some of the lasering. And while that might be part of the treatment plan, a lot of times the redness reduces just by actually addressing the barrier issue.
Yeah. So sometimes, lasers are amazing, and we want to just dive right in, but sometimes we really need to just restore that barrier and make it all nice and healthy.
Yes. Next question, is the treatment combinations painful? So we do whatever we can to help these be comfortable for you. A lot of times with the first BBL series, we do want the patient to not be numb. We want the feedback while we're doing that treatment. But as we need to get more aggressive with the treatment, if it's appropriate, we will offer a topical numbing cream. For the Halo, we absolutely want you to have some numbing cream. So we'll make sure that you're nice and numb for that. Plus the treatment actually has built-in cooling. And then for the CoolPeel, really it's optional on numbing. Some of my patients don't numb for it. Some choose to. If we're getting more aggressive, a lot of times they want to do it. But when Mindy and I first got the device, we played with it. I didn't numb for anything, and we were lasering away just to kind of see what it felt like and what we could do with it and everything else.
The thing about all this is people do get scared about the pain, right? We deal with this on a daily basis is what we do. We do kind of inflict pain, I will be honest. But
it's our job.
It is our job to make you look beautiful. But, pain is relative to everybody. I've had people that were so terrified to do a treatment. And once we got into the treatment, they almost felt silly because it didn't hurt. But like Chris was saying, we have so many different things to help to facilitate your comfort. So we have something that blows the cold air. We have the laughing gas that really we don't see people need it for these procedures because the numbing cream really does take the edge off. The Halo is honestly, both Halo and CoolPeel with the numbing is very, very comfortable. Most people prefer the Halo over getting a BBL just because of the light that's associated with the BBL. Typically, again, we can make you comfortable during the procedure. It's after the procedure. And it's not that you're in pain. It's it's a severe sunburn.
Yeah.
So if you're, sensitive to the heat, kind of like that, but it does subside within about 2 hours. Maybe you have some residual heat, longer that, depending on how aggressive we are. But typically we really work to make y'all comfortable for these procedures.
And honestly, if you've ever had a full body sunburn, this is so much easier to deal with than that because it's isolated to the small areas that we're treating. So to me, it's not real sensitive, but I also don't have sensitive skin. So everybody's a little bit different in how they feel.
I have sensitive skin, but I can get through it. Having my tops of my feet being sunburnt was way worse than any laser treatment I had. I can promise you that. It was probably just as swollen.
We have a question of, can I combine these treatments with injectables like Botox and dermal fillers?
So, yes. we like to space it to where we know that we're not going to be doing anything. So you can do your Botox and fillers prior to doing your treatment. You want to do it 2 weeks before. We want to make sure that everything is set and in place. You can actually do Botox directly after these treatments.
Mm-hmm.
They won't do any type of filler though directly after these treatments.
Swelling is the reason why.
You get swollen somewhere, they don't know where to put it. You want to make sure that they're putting it in where you want it. And then even sometimes with halos, we can do so much correction with it that you may not need that filler in that area after it's kind of set in. So it's almost saving you a little bit of money.
Yeah, absolutely. So I have a question here on what are the side effects or risks associated with using BBL, Halo, and CoolPeel together, if any?
Well, there's always these are medical procedures, and we take this at Dermatouch very, very, very seriously. As if you are a client here, we make you sign a consent every time. We go over medical history. We make sure that we update your medical history on
routine basis.
Yes,
and we ask if there's any changes. We want to know all of those things. And there are specific questions that we're going to ask before we do certain procedures as well.
So with that being said, we're going to make sure that it is safe for you, but there's always a risk when we talk about lasers. There can be burns, hyperpigmentation, hypopigmentation. There are risks. And then you also have to be really careful with your post-care, and that you're not going in the sun to get some of these risks. Sometimes that's a big one where we see hyperpigmentation is typically when someone has gone out into the sun or hasn't done something that they were supposed to. Chris and I have done hundreds and thousands of these treatments, and we take this very seriously, and we will do what we can to make sure that it's safe for y'all.
And really the thing is, it's a partnership with us and you as a client. So really you following instructions, making sure to ask questions, that's all part of a successful treatment plan.
Mm-hmm.
How many sessions of BBL, Halo, and CoolPeel are typically recommended for optimal results? We kind of went over that a little bit earlier. So again, most people need somewhere between 3 to 5, possibly 6 on the BBL. And then for CoolPeel, on that one, it's typically 3 to 5, depending on what our goals are, as well as taking into consideration skin type. And then Halo, I would say, Mindy said 1 to 2 typically. Again, it depends on if we're in maintenance or if we're trying to do correction. Sometimes I have a patient who really maybe needs to do deeper resurfacing, but they're not wanting that downtime. So sometimes there's a more robust treatment plan. I currently have a patient where I've counseled her, let's expect for sure 3, possibly 4, based on the goals that you're looking for, but not wanting to get into the deeper resurfacing.
And then, so I want y'all's imaginations to run wild on this. Let them go. Think about this. Anything that I do here, I can treat your whole body with. So the question is, can this be done on the neck and chest?
Absolutely. We highly recommend it because once this looks good, you're going to start to notice this. So you might as well just kind of bring on down the treatment. But yeah, most of the stuff, you know, we have arms. It looks like halos and BBLs, CoolPeels. This all looks fantastic. Not only when you look at your arms, sometimes when we do these, like the BBL is wonderful for the, you know, the brown spots, but when we start to get that crepey and that kind of roughness in our skin, this is where the CoolPeel and the Halo comes in. It really helps to give your skin a rougher, not rougher, maybe for a week. Thank you.
And you know, to that point, I had a patient that I worked with that we did her upper back and arms, and she got phenomenal results. That was a 2-treatment series for her, and it was BBL Halo. So it improved her tone as well as the texture. You could see improvement in the texture on the inner elbows as well as the folds behind the upper arms. So we can do it everywhere. Next question. What did she receive BBL? And I assume that that question has to do with the model that we treated earlier in the video here. And Mindy did BBL and CoolPeel on that model.
Yeah, we did the BBL to address her redness. She's got a little broken capillary that she wanted to work on as well. So we that was why I selected the BBL, because of her redness, and then pores and some texture. And while BBL will help pores and will help texture over time, it will help texture. And this is a long ongoing treatment plan with just BBL. So to get her to where her end goal was, we opted to do the CoolPeel on top of her BBL to help get her to that end goal, to resurface her with that CoolPeel.
And CoolPeel is great with fine texture. So that is a great service to go to. Next question is, what should I be doing before and after this combined treatment for the best outcome? So there are definitely certain things that you'll need to avoid beforehand. It's typically, especially if we're trying to get into BBL, it's good to make sure that any active tans are, you know, not present, and that really your skin is as light as possible. That's going to help with the best outcome for BBL. It's a little less important for the Halo and the CoolPeel, but for sure with BBL. And then obviously the sun exposure, we've talked about that. It's very, very, very important. Avoiding retinols and chemical exfoliants before the treatment as well is important. And then we'll really go over everything with you when you come in for your consultation.
And then, you know, everybody, all this stuff, we all have a budget. And, you know, these range anywhere from $300 to about $1,400. So, and then you can fall in between there. We do different pricing for different body parts as well, because different surface area. So to get like, we always recommend a consult so we can make sure that we go over that pricing and that we're very transparent on that. And so you know what your total cost would be based on how many treatments we need in that treatment plan.
Plus, we have a wonderful membership that allows you savings on all of these treatments that we've discussed today. So again, it just depends on which modality we're looking at, but you can save a dollar amount off up to an actual certain percentage. So the higher price treatment like the Halo, we actually offer a 20% discount on that service, but we do also have some laser season specials. So if you were to purchase a BBL and Halo combination, or a BBL series, which would be 4 treatments in that series, or a Halo only series of 2 treatments, you can receive an additional 10% off of that series and receive a free Skin Medica Even and Correct serum. So that is through the end of November. And then CoolPeel, we're also offering a standalone treatment for $4.99 for our non-members, or $3.99 for our members. So what that means standalone is it means you can just come in and do the treatment on its own. Typically, we offer that as an add-on pricing when we're doing another treatment while the client is in clinic.
And there is a question about the difference between Botox and filler. We leave that in the hands of our nurse injectors. So that would be a nurse or a nurse question. more or less than us. Botox is a neuromodulator that does freeze the muscle, where filler, though, is to replace volume loss and or bone loss as well, just depending. So I would highly recommend seeing one of our amazing nurses.
We are actually able to treat many skin types with these services. So obviously we, may deliver a little bit more of a conservative treatment based on the skin type. So the question was olive skin and would like to help with lines above the lips. So that is one of those particular situations where we want to give a consultation to assess the patient correctly and be able to give a good treatment plan for them. Sorry, we're just looking at the how many sessions would I need for crepiness around the eyes. Again, seeing a patient in person would help us give a better assessment, but crepiness around the eyes is actually a really good, these services address those really well, especially CoolPeel.
CoolPeel, oh my God, CoolPeel. It is probably one of we can get so close to that lash line with this handpiece with CoolPeel. So Chris and I like dork out like, dude, guess how close I got today? And so we love it for that. And then this question, this makes me so excited. Besides, lasers just get me excited. Anyways, but we do offer exosomes now, and we are playing with them to see if we can do them directly after the treatment. They are pH balanced, so we're hoping that they don't inflame you too much. But we do have it as an add-on that you can potentially do directly after or potentially the next day. Mm-hmm. We also have a Glacial RX that is a cold facial that you do come in the office 24 hours post CoolPeel or Halo, and it helps with the inflammation and redness. Mm-hmm. So that is some things that we can do to help get you through your healing journey. We don't just leave you alone. We've got plenty of things to help you get through it. And then working out. There's an easy way of saying it. Working out, 24 to 48 hours, CoolPeel's Halos, up to 72, even further on. My kind of thing, I like y'all to let your skin tell you what needs to happen. Yeah. If you have redness or puffiness in your tissue, in your skin, you still have inflammation. You still have that heat. So you don't want to add any extra heat. Once that starts to subside, you can start increasing your workouts and your hot showers.
And here's another really good question here. Can you mention how the exosomes can help or enhance the healing results? So Mindy kind of touched on that just a little bit, but really, like she said, it can actually reduce the healing time from the treatment. And also the actual things that you're feeling. So like any irritation, any redness, swelling, etc. All right. As a reminder, you'll be receiving a text message, and if you would please reply with the code HAPPY to be contacted for a consultation. So that's HAPPY. We appreciate you guys joining us this evening. And once again, thank you for staying until the end. We do have 3 great prizes that we'll be giving away, and the winners will be contacted. So again, those were a complimentary Halo, a $250 gift card, or a free hydrocollagen HA5 skin rejuvenation treatment. Well, serum, sorry.
Yes. And then there was a lot of questions we didn't get to. We do apologize for that. We'll be reaching out to you, and we'll be able to get a game plan and answer any other questions you do have. We hope to see you here in the office soon. Enjoy the rest of your evening and take care. Bye.